Hi, I'm Shan.
And I'm Marcus.
We are medical students from AMSA IMU bringing you the third episode of Trust Me, I'm a Doctor. Almost. For this episode, the theme is sexual health. So it's a girls' party, but boys are invited because sexual health does not discriminate against any gender. We'll be discussing everything about menstruation, period products, hygiene tips, contraceptives, and even the social cultural aspects about it.
And before we begin, just a disclaimer. As mentioned in the title, we are not actually doctors. So this is just our way of sharing our personal opinions while speaking to certified and experienced people from their own personal fields. So if you do have a medical condition, please do not take our podcast as medical advice and seek professional help from real doctors.
With that being said, allow me to introduce our honorable speaker for today, Professor Dr. Nazimah, who actually is a professor here at IMU teaching obstetrics and gynecology, specializing in adolescent reproductive health. She completed her medical degree in University Kebangsaan Malaysia before being awarded a fellowship in maternal fetal medicine in Brisbane. Prof. Nazimah, thank you so much for joining us today.
Thank you, Shan and Marcus,
Thank you.
for having me.
Yeah. Would you like to give a brief introduction to our speakers today?
Introduction about
Yourself.
myself. Oh, okay. Thank you. My name is Nazimah. I'm a professor of obstetrics and gynecology in IMU, and previously I was a consultant obstetrician gynecologist with the Ministry of Health Malaysia. Beside the ONG master degree, I also had a fellowship position previously in Mata Mothers Hospital Brisbane, where I did work on maternal fetal medicine. And following that, I had a master in medical education from University of Dundee. And after that, I had a postgrad diploma in healthcare ethics and law from the University of Manchester.
Oh.
So that's my formal training. And I've been doing specializing and doing ONG work since the last 23 years. Yeah, and my, of course, area of interest, and have done quite significant work in adolescent health also. And I even have an adolescent health project running for many years now in schools around Seremban. So I'm very familiar with the topic that we're going to discuss today.
Wonderful.
All right, thank you so much. For when I found out that you'll be here with us today for this podcast, someone with so much training and experience, I was actually super excited because I personally have a lot of questions about menstruation. Because
Sure.
growing up in a relatively conservative environment, I find that there's not a lot of opportunities to discuss this topic openly with my peers or even the older generation. Yeah, and I'm sure a lot of the listeners today would agree that even though this is not our first time experiencing periods, we're still very confused about what happens every month and like the bodily changes that come with it.
Yeah, I can understand that. And I shared your sentiment because I've been advising young people about their menstruation problem over the years. And I've also met mothers who said they're not very confident to talk about it with their daughters, considering that they are not trained in the field. So there is still a lot of work to be done for more understanding and also to correct misunderstanding about menstruation. So this session today is actually very appropriate and important. Yeah.
Actually, doctor, I wanted to ask, before we begin, could you just briefly, very briefly, just describe, we all know that menstruation happens, but could you tell us what exactly is the cause of bleeding in it? Why is that blood?
Okay, all right. This is a very good starting point. What is menstruation itself? You recognize that you're having menstruation when you have bleeding, but where does it come from? The bleeding actually comes from the inside layer of the uterus. It's actually the endometrium. So if you go by Marcus, the discussion cannot be very brief because because we need to make you understand. So you're familiar, if you're a medical student, you're familiar with the pituitary, hypothalamus, pituitary, ovarian, endometrium axis. So it's the whole process that gives you your menstruation. So the hypothalamus will stimulate your pituitary gland. That is where your follicle stimulating hormone and luteinizing hormone is being stimulated. In turn, this will stimulate the ovary, where it will cause follicular development, and also will stimulate the endometrium, will cause endometrium to thicken. This is actually all process that happen in preparation for a pregnancy. So if you ovulate and then you have sexual intercourse and the egg meets the sperm and it get implanted in the endometrium. When you do not have pregnancy, menstruation happen. So what happened during menstruation is the endometrium layer that's been preparing for pregnancy that did not happen, and the hormones that were preparing for pregnancy that did not happen also will have hormonal changes and endometrial changes, and the endometrium will be expelled. So what you have in your menstrual blood is endometrium plus the blood that comes from the inside layer of the uterus. So
Right.
basically that is that. And it occurs cyclically.
Yeah.
And the cycle is usually monthly, roughly. So that's why you call it monthly bleeding or the menstruation.
Right. Yeah.
I hope that is.
Yeah, that's very
Yeah,
concise. Thank you
that's
so much,
very
Doctor.
good,
Yeah,
very
that's
comprehensive.
very concise.
So it's like if like your body's preparing for a baby and it's like, oh, there's no baby,
Yeah.
and it just
Yeah,
for every
that's
month.
correct.
But like because like you said, Prof, like it happens so naturally and so often, like once a month. How do we know when it is actually something concerned?
Okay, when it's normal and when it's not normal.
Yeah.
Yeah.
Okay. So when we talk about menstruation, there are a few aspects to the normality of it. First is how regular it is. So how frequently does it come, or what is the interval? So the normal interval, or you call it the normal cycle, is normally between 21 to 35 days, between 3 to 5 weeks. Typically, it is between 28 to 30 days. That's why it fits into the month. Okay, but you will notice that you do not normally bleed on exact date of the month, because the month has 30 days, 29 days sometimes, and 31 days. So normal cycle is between 21 and 35 days. Normal flow, normally between 5 to 7 days, but you can have slightly less days or slightly more days. It could still be normal. The volume of bleeding normally should not exceed 80 mils. If you exceed that, then it's a bit too much bleeding. And you might have some cramps because the uterus is contracting, but you should not be too painful. If it is too painful, then it is not normal anymore. So it is not normal when the cycle is not regular, the bleeding is too much, and it's too painful.
Doctor, I mean, like you said that it will be about 18 mils, right? But like, is there any way like they can
We can
tell?
calculate.
So it's a bit hard to say.
Yeah, 18 mils is from the scientific research that the average
yeah.
should not be this. But in a lot of time, it's your own perception.
Right.
Your own perception that this is normal bleeding, 4 to 7 days, and you do not need to use so many pads in a day, and there is no flooding where it just comes out so much and there's no lot of blood clots.
Yeah.
So you can largely tell.
Okay, but then like for every female, they experience menstruation pain and cramps very differently. Sometimes there's like blood clots, right? If it's like slightly bigger, would that be like concerning?
A lot of time the clot is not worrying unless there is huge clot. The concern when you have huge clots is you're bleeding more than usual. Okay.
For longer time?
And well, you can have shorter duration period but very heavy bleed. You can also have longer duration but just average bleed. So it's a bit different with everyone. But too much bleeding, a lot of clots, too painful signifies probably an underlying problem.
Would it be a serious condition?
In a lot of time, it is not, but it's enough to cause you to miss classes, to have to take medication, to pay a visit to the doctor. In young people, when I see young people with very painful menstruation, their cause is what we normally call a primary dysmenorrhea. It is not because of some underlying organic problem, just that your uterus, this is your first few years of having your period, and therefore there are a lot of process that goes on that give you pain. It's also a very complex scientific explanation, but I think it's quite enough to say in young people with very heavy or very painful period, the cause is mostly functional and not organic. For older people, when you have very painful, very heavy period, we look for other organic causes like fibroid, endometriosis, and all that. Okay?
Right. Doctor, I want to ask also, apart from bleeding, the abnormalities such as the bleeding and cramps, I've also heard about something known as PMS, right?
Okay.
Or like PMDD, I'm not too
PMDD,
sure.
yeah,
Is it?
yeah.
So is it actually a thing, or is it like a made up excuse or people to justify?
It is a formal diagnosis
It is,
actually. PMS is premenstrual syndrome, and PMDD is actually the most severe form of PMS.
Right.
Actually, premenstrual dysphoric disorder. PMDD has just been recognized several years ago. Before that, it was not recognized as an entity.
I see.
PMS, I think a lot of people are very familiar with it. It is the days before your period where you have symptom.
Right.
And this symptom is something like you're feeling bloated, breast tenderness, you're feeling a bit emotional just before your period. A lot of time it is manageable, but it can cause you to have a bit of disruption to your daily activity because you're not feeling so good. And you will notice that it happened during the luteal phase, which is the second half. Period has proliferative phase and luteal phase. So it happened after ovulation mostly. So you have PMS. I think you're quite familiar with the word. Okay, I'm having PMS today. You don't disturb me. Leave me alone and things
like
like
shine
that.
all the time.
Yeah. But when it becomes PMDD, it's so much more severe. We add on a few more severe. It can be the severe hot PMS plus a few other things. So severe feeling of bloatedness, breast tenderness, highly emotional. There's also feeling of hopelessness, extreme sadness, anxiety, which is actually totally disruptive. And it comes during the luteal phase and normally goes away when the period flows start to flow.
Right.
Okay. So this is the two entity that Marcus asked that it is actually real. And whenever patient comes to me and say I have this, I'll pay serious attention to it because I know how disruptive that is to their life.
Yeah.
There's no like changes to like you can't really treat it, is it? It's just all
You
symptomatic.
can treat it. You can treat it. If it is manageable, then we'll probably just say, okay, just bear with it for a few days and you'll be all right when your period starts. But when it is PMDD, it can cause you severe disruption to your life. So we treat it. There are many ways to treat PMDD actually. It even includes some psychotropic drugs. Psychotropic drugs to treat your feeling of severe sadness, hopelessness, anxiety. And the other medication that we normally use is oral contraceptive because it stabilizes the hormone. It does not cause it to fluctuate and it helps the symptom to some extent.
Okay. Doctor, I mean, like, they are more sensitive, right? Like, it's because of the hormonal changes as you mentioned.
We think it is hormonal.
Right.
It's the hormonal.
And is there anything that you said apart from the drugs? Is there anything that we should take note of or that we can do in order to be more supportive and also to help alleviate the pain?
Yep. There are a few suggestions like observe your diet, keep doing your exercise, get your endorphin to come out, get a good support from your friends. If you smoke, stop smoking. If you take alcohol, stop alcohol and things like that.
I'm not sure if you heard, but like there's always this common saying like, oh, avoid oily food. Is that like actually true?
Not really. Not really. Yeah.
So besides that, doctor, like with all these like tips, do you think there are a lot of like hygiene tips that most women tend to forget or like ignore?
Yeah, I think in modern times like this, most people are aware of the hygiene issue. So if you're going to use some feminine product for your menstruation, you know that you must use a very clean one. You don't use the recycled one. You don't just use anything to hold the bleeding from soiling your clothes. So there's a lot of modern product like you're very familiar with, like tampon, sanitary pads, menstrual cup. Yeah.
Which should be better, doctor? Do you like? I mean, is there any
I
recommendations?
don't think that one is better than the other. As long as you keep it clean. But of course, if you don't change it and you leave it on for too long, that is not sanitary. In the bad old days, there is uh, symptom or problem related to use of tampon when it was not changed so
I see.
frequently. Yeah. So, but nowadays I have not heard of it anymore.
Yeah, with the upcoming like period cups, I think a lot of people would prefer that because it's like more like it's more
Environment friendly.
environment friendly or
Yeah.
like it's not as
Sustainable.
it's not as costly in the long run.
Yeah, because you can reuse it, which is actually a very good idea. Because I think we with the disposable material, we're actually harming the environment, obviously. Yeah, but there's also washable sanitary pads that you can use
Or
and not
the
just disposable ones.
or they like period underwears. I think it's quite new.
Yeah,
So.
that's good also. I think we are moving in the right direction. when especially young people are more aware of what else can be done to reduce effect on the environment, which is actually very good. Yeah.
Right, doctor. I actually wanted to ask also, as I understand, sexual health is not only about the menstrual health, but it also encompasses any form of healthy sexual intercourse.
Okay.
Right. So apart from products that can be used for menstruation or things like that, like is there any way we can sort of practice safe intercourse or prevent, like you mentioned, Prof mentioned, pregnancy scares or any form
Okay.
of sexually transmitted diseases?
I think in relation to sexual health in regards to sexual intercourse, sexual activity, or sexual exposure, there are a few things that is critical to be paid attention to. One is prevention of pregnancy. If you're not
Right.
ready for pregnancy, then you have to make sure that you don't get pregnant.
Yeah.
Second, transmission of sexually transmissible infection.
Yeah.
We want to prevent that. And number three, of course, the emotional issues that comes with a sexual relationship.
Yeah.
For example, abuse. Okay, so these are the three things that I think we must pay attention to.
Right.
Yeah.
And like we all know in the market, like especially now, I'm sure a lot of people will be very well aware with like contraceptives
Okay.
and everything, right? Prof, could you briefly explain like what would be the effectiveness or benefits of all these contraceptives,
Okay.
or even like the harmful effects of it?
Okay.
Be
So
aware
the
of?
couple that I saw before I came to this session just now actually came solely to discuss contraceptive because they're
Right.
not ready for pregnancy. So when we talk about contraceptive, we know in the market there are a lot of
Yeah.
contraceptive. We have
Yeah.
oral contraceptive, we have injectable, we have
Yeah.
implant, and we
Yeah.
have IUDs mostly.
Yeah.
Or you have condom, or you want to just use your fertile period or withdrawal method for contraceptive. So when I talk to young people about this, I said one is it has to be very effective to prevent pregnancy because you're definitely not ready for a pregnancy. You're still in school and things like that. Second, transmission of STDs.
Right.
So for transmission of STD, only condom is protective.
You see.
Actually. For prevention of pregnancy, you can use any of the method. For young people, we would normally advise probably double method. So the girl can use oral contraceptive for her own protection, and you can add with condom for STD transmission. This is also to empower, because if you're going to say use condom, then my concern is the girl will have to be dependent on the male partner to be disciplined to use condom. So that relationship probably a bit imbalanced. So the girls can protect herself by using oral contraceptive, and they can add on with the condom to prevent STDs. Okay.
But Prof, that's not absolute, right? I mean, to some extent, there is whatever the case, still chances of pregnancy.
Yeah,
apart from
nothing
that.
is 100%
Right.
in this world.
I see.
Yeah. But contraceptive has an efficacy of 90 over percent, close to 100%
okay.
if you use it as it should be used and not missing your pill and not
Right.
taking it when you should be taking it.
Right.
Yeah.
And the pills, like, would it be negatively? I mean, would it be harmful?
Yeah. Pill has received quite bad publicity over the
Yeah,
years,
right?
although it's actually one of the most effective medication. But the later oral contraceptive that we have nowadays, she has a very low dose of the substance in it, just enough to give you the effect that you want, which is prevention of pregnancy and minimizing the other side
The
effects.
side effects.
And you should be happy to know that oral contraceptive also has a lot of other non-contraceptive benefit. So you can take the pill for prevention of pregnancy. At the same time, your cycle is regulated. You don't bleed as much. You don't have period pain. You don't have PMS. And in the long run, it also reduces risk of ovarian cancer.
Oh, okay.
Also reduces breast cysts. Also reduces ovarian cysts. So this is what we tell our patient when they are a bit concerned about taking pill, because I said you will get the non-contraceptive benefit also from your contraceptive. Of course, side effect will be like feeling a bit nauseous when you take it, bloated, maybe a bit of water retention from there, but those are mostly manageable nowadays.
So it's not very severe.
Not severe. And if we prescribe, we will look at your profile and we know who are those that we should not prescribe oral contraceptive, for example. If you have, there are a lot of guidelines, but if you're obese, you're a smoker, if you're older, if you have history of blood clots in your vein, then oral contraceptive is not for you.
Right.
So they will have to do like lifestyle changes before they can actually get the contraceptives or
Either
alternative
that
means?
or we use other alternative. Yeah. That's why actually choice of contraceptive is individualized. We have to look at your profile, your preference, your discipline before
Even
we
I
can
think
prescribe
it
it
will
to you.
cost differently as well.
The cost?
Yeah, like
Yeah.
all of it.
Right. Thank you so much, Doctor, for sharing. And the last thing we wanted to discuss with you about was actually related to what Shan mentioned in the beginning. How, right, you said that you're unable to speak up in the community, and how she can't really discuss all her problems with. Like from your experience, like could you like sort of share with all of us, how do you think we can approach or break this sort of social barrier and the stigma that surrounds this menstrual entire topic?
Okay. In the first place, we have to admit there is a taboo.
Right.
Although I think in nowadays it's probably not as bad as the bad old days. Taboo is the restriction. Like if you have your period, you cannot do 1, 2, 3, 4. There are things that you definitely cannot do when you are having your periods for sanitary, hygienic purposes, for religious purposes. That I would consider that not as a taboo. But other things like because you have your period, you cannot be together with the others. You cannot eat together. You have to be separated. And it was not paid due attention where you need your menstruation items like clean sanitary pads and just use whatever clothes that you have in the house. Okay, so we have to admit in some society probably there
Especially
is still
Asian, right? Prof?
probably there is still something like that going on, although I don't see that much of it anymore nowadays. I think because
More
we
progressive.
go to school, we understand things and people are more understanding of that. I suppose nowadays men are not shy to go and buy sanitary pads for their sisters or wife or friends compared to the old days, right? So we have come quite some way from then, but still you have to continue educating. You have to make them understand that menstruation is physiological. It is not bad. It is normal, but it can also cause problems that we have to attend to. So if we can educate both men, women, boys, girls, then we can support each other and we can give correct information. Nothing to be embarrassed about. If you bleed so much and you leak, for example, then people should not laugh and look at it the wrong way because she's having some medical issues. Okay. So that's how we look at things, I think.
I think even though it doesn't affect males directly, we still have to be a bit more.
I think
understanding.
the male role are supportive. You have to play the supportive role. Say if you're, for example, if your girlfriend or if your friend is having her period cramp, so you can help by go out and buy some medication or give her hot water bottle and tell the other friend that she's not having a very good day and things like that. So you just support. That's what I think women need mostly when it comes to this issue: support and understanding.
Prof, but like knowing the lack of, I think, especially now in the community, knowing the lack of sexual education, like I mean, as well as awareness, like how do you think we can not sort of incorporate sexual education into the community or the future generation?
I think the recent years science syllabus, the biology syllabus in school, talk about some biological process,
I
but
think
perhaps
slowly,
it is not at the level of application that affects how we perform in our society. Let me tell you about my adolescent health project that has been running for several years in Seremban School. So we noticed the gap that these young people are having because they don't get enough information. So what I did was I approached the school through the Ministry of Education and say we would like to offer this to school. We would like to come to the school. We want to talk about reproductive health. Yeah, we did not use the word sexual health because it was a taboo.
Right, yeah.
So we used the word reproductive health. And what we did was, and it comes under the bigger adolescent health issue. So there are 4 areas that we concentrated upon. One is the male reproductive health, because Marcus, your reproductive health is not being paid enough attention to by
That's true.
society either. Female reproductive health. We have substance abuse station, because this is also something that the young people are concerned about, and mental health issues. So these are 4 things that we address at the school that we go. So IMU student, the school student, and the faculty member will talk about all this, and we answer all their questions, and we get them to understand this, and we also educate their teachers, just like what you are doing today.
Yeah.
So I've gone down to the school level
Yeah.
to directly talk to them about this. So we will keep doing this until we cover a bigger area. Because we have the understanding about this.
But because I think the audience is slightly younger, maybe in high school. So is there a different approach to how to talk to them about?
The school that we went was the high school, and I think I talked to them the same way I talked to you, because they have done their reading, they have some understanding, but they also have a lot of questions because no one is talking to them about that, not their parents, not their teachers, and it is actually a personal thing, so you have to address it as such.
Okay, so we shall keep that in mind. We are coming to the close to the end of our podcast episode. Today has indeed been a very fruitful and enlightening conversation we had with Prof Dr Nazimah. We spoke about what exactly is menstrual bleeding, what is PMS, and when to tell whether the bleeding may be dangerous. We also discussed various methods of maintaining menstrual hygiene and also healthy sexual intercourse. And last but not least, we also covered ways in which we can support those who are going through menstrual pain and how we can break the social taboo surrounding this entire topic. So this is very much a very relevant topic, not just to the female, but also to the male, all of us, as we should also take note and support all the females around us, our family, friends, and partners.
Right. So before we end, we would just like to again express our deep gratitude and thanks to Prof Dr Nazimah for sharing your experience and knowledge and even the project with us. So I hope that the listeners have something learned today. And thank you so much for sticking to the end of the episode.
Thank you so much, Prof. Despite your busy schedule, is there
Thank you for
anything?
having me.
Right. Yeah. Is there any other thing you'd like to mention to the audience before we end? Some last words?
Of the things that we have discussed today, I think we have to approach it from, I would say, a very respectful kind of manner and kind. So people, menstruation, perhaps it is actually a physiological process, but along the way, it has got a lot of social, cultural, probably also religious issues that is attached to it. So we have to approach it that way. I would always look at things from the medical point of view, of course, whether it's normal, not normal, and also how to support, because that's what we do, people with this problem, and the approach has to be respectful and kind. Okay, right. That goes for everything that we do actually in life, but
that's true.
Most relevant to what we are doing today.
Right. Thank you so much, Prof. Thank you.
You're very welcome.
Thank you so much, everyone. Do keep a lookout for our next episode entitled An Aging Society, where we will be discussing how we can support the elderly community. And remember to follow us on AMSA IMU on Instagram and watch out for upcoming events in July. Until then, stay safe and take care. Thank you very much. Bye-bye. Thank you so much, Prof.
Well done.